Is my mic working? Mic test. Ooh, hold on. Hold on, chat. Hello? Hello? Oh, God. Taka lang. Naka-on pa rin yung ano ko. Okay. Hello, good evening, guys. Good evening. Nice. Now the question is there a delay? Is there a delay? Baka naman rinig niyo ako. You guys can hear me, but there's a delay. Let's see. Oh my God, there's a bunch of you here. Okay. Hello, Manachan Noy. Hello, Popmaster Spammer. Hello, Jax, Archetype Jaya, Jello Official, Akdog, Minokalu, Nimby, hello, 2S, hello, hello, Milkshake Speed, Red. Good evening, Kodak, respectfully referring patient for toss, probably partial gut obstruction. Oh my God, I'm on leave. I'm on leave. I'm not accepting that. Sleep deprived Chatino. Hello, good evening. Wala naman delay. Okay, I don't think, I think there's like a slight delay, but I think no, it's not that bad. I don't think it's that bad because you guys seem to be on time with what I'm saying. Laging nagsiswitch to top message. Yeah, it happens to me too. I just switch it back, you know. Anyway, how's everybody? Did you guys miss me? Na-miss nyo ba ako? Did you guys miss me? I've been gone for like, I don't know how many days. Almost a week? No, not really a week, but almost a week. Dok, pwede mo bang buksan yung thorax nang makita mo na ikaw ang lang tinitibok ng dibdib ko? Wow! Wow! Hayop yan ah! Diyos ko. Okay, actually, you know what, guys? Before I start, I'm actually cramming something right now. I am cramming something right now. Something work-related. Teka, gagawin ko ngayon. I'm cramming it right now, guys. Teka lang, ano ba yun? I gotta submit stuff on a Google form na ano. Teka lang. Hayop to. Hope you okay. Sound tiring. Yes, actually the past, how to say, the past few days, or actually this whole week, this whole entire week has been crazy. Like, I had a lot to do. Like, if I remember correctly. I remember correctly, I had where's my previous stream schedule of the week? My previous stream schedule. Here we go. I only had like 3 streams scheduled, right? So we were able to finish Claire Obscure last Monday, and then Tuesday I did a just chatting stream here, and then after that I was supposed to. That Wednesday, Thursday, Friday, I had no scheduled streams, right? Because I was predicting a really busy, or not really predicting, but this was the week when I was trying to recover from like being burnt out, right? Like because I felt like I was being burnt out, so I wanted to take it slow last week. So I didn't stream for those 3 days. But you know what happened? what happened was I got 2 stat operations on those 3 days. And then Saturday I was supposed to stream Tekken 8. And then I got another major stat operation on that night. As soon as I posted that I was gonna stream Tekken, like maybe like a few minutes after that, I started getting calls. And I was like, oh no, no. I was like, oh god, I'm tired, man. I was tired. I wanted to, when I posted that, I was like, okay, I'm gonna rest for these next few hours so that I can prepare for stream. But no, what happens, like, after I posted that, I was like, I got a call and I'm like, oh my god, I can't rest. No. Nagpapalevel up si Doc IRL. Di ako makachat sa Twitch streams mo, Doc. Di ma-verify ni Twitch phone ka, sadness. You need to have you need to keep trying to sign. Okay, Doug, you need to keep trying to sign in because you're supposed to receive an SMS, right? To log on, right? So when you are able to log on, as soon as you're able to finally get into your account, download Authy app. Okay, download Authy app so that the next time that shit happens again, it won't be hindi siya sakit sa ulo. It won't be a headache. It never says, just keep doing it. Eventually it will. It happened to me before. That happened to me before. Don't worry. It happened to me before, and at the during that time I couldn't stream on Twitch. I couldn't stream on Twitch. Like, it happened for a long time. It happens to people. It takes a while. It's Twitch do be like that. It's so stupid. It's honestly so stupid. Did someone eat noodles or something? I don't know. I really don't know. Anyway, wait. So while I'm streaming, while I'm chatting with you guys, I am doing work-related stuff. Gosh, okay. Wait, what's this? So, yeah. While we are doing this, I am just doing some work-related stuff. What's this? Six. Let me see. 6. Okay. 6. Naka-login ka na, verify pa. Age verification. Umabot ba kayo sa Tuli last time? Oh nga, no, it's not Tuli season anymore because school started, yeah. Let me just finish this, okay? I have to cram this. It's just gonna take me a while, and then we can chat. But you guys can continue chatting, and I will answer you. I'm just cramming something right now, like. Really. Kamusta ka, Doc? I am okay. I am actually the past, after that day when I was supposed to stream Tekken, after that I was so tired. Because, you know, it was an emergency. It was a major surgery, actually. A major emergency surgery. And what do you call this? I got home really late at night. Like past 12. Past 12, that's how, and then when I got home, I was just like, dead. I was just dead, man. I will tell you about that surgery. I will tell you about the surgeries I've been doing the past few days. Kami muna mag-stream para sa'yo. Hi, Night Chase. Hello, hello. I'm just cramming something. Okay, guys, I'm sorry. I'm just cramming something while I'm doing this because I have to do this. I have to submit this early. Okay, there we go. I think this is okay. Okay, I think this is right. Eh? What happened? What? Wait, why did it not? What happened? This is weird. Why is it not accepting my... Eh? Hold on. What? Okay. Oh, there we go. Okay, there we go. We good. I'm going to... I need to send proof that I've done this. Hold on. Let me finish this. Alright, okay, I'm done. Okay, we good. I can close this and be good. Okay. I have to clean up my freaking desktop after this. Okay. Alright, guys. So... This is... Wait, what is everybody saying? Si Pokari daw muna mag-entertain si chat. I doubt the results come back from the exam. Alright! Yes. Okay. Yes, I passed. Oh no, I didn't tweet it. I actually didn't tweet it. I only posted it on Discord. Because I didn't wanna... like announce it to the entire world. I just kept it on Discord. I chatted it on Discord. So, yeah, I did. I passed amazingly. Yeah. I know, right? And now I have to take the oral exam, which is this August. I'm planning to take mine in August, so I have to start studying again. Di ko pa rin mag-gets Discord kahit naka-follow ako. What do you mean? What do you mean? Congrats, thank you. Yeah. So, yeah, I passed the exam, so I was really happy. They announced it last Friday, actually. Last Friday, they announced it, and then I was really nervous. Actually, that Friday, I was really nervous. I wasn't tweeting much the past week, or even in Discord. I wasn't really messaging much because I was really busy. I had a lot on my plate, like really a lot. I was so busy, so busy, and I had a lot on my mind, and I was really nervous. I was anxious, so anxious. I was nervous, and that's why I was really quiet. And I wasn't really able to play any video games. I wasn't even able to play Tekken, but I did have a session with my coach, and that was it. What's funny is that When I had that session with my coach, I literally just got home and then logged on the Discord and opened up Tekken just for that session. And I was like, and then he asked me, okay, so how are you doing? And I'm like, I just got home. I just got home and I'm tired. I'm sorry, but I still have some energy for this. So yeah, but at least he didn't really make me play. I wasn't really able to play Tekken. He just like taught me stuff and that's it. Nothing too energy consuming. So yeah. May lumalabas na follow to something in Discord tas wala naman ipa-follow. What do you mean? No, maybe you when you join my Discord, you have to react to the rules to have access to the entire Discord server. If you go to the Discord and then look at the rules, you have to react to it and then it'll give you access to the entire Discord server. And then you go to roles and react to the roles that you want. So yeah, that's how you access the Discord server. So I know. Wow, Pokari is actually here. Pokari, nandito ka pala. Akala ko sa ibang paa ka na eh. Anyway, so yeah, it was really busy. Very busy. I'm gonna check. Yeah, maybe you didn't react to the rules in the Discord server. You have to react to it to access the entire server. Yeah. Hi, Doc from India. Oh, hello. Welcome to the stream, Kartikawate. Hey, welcome. Babalik sa paa mo, Diyos ko, Lord. Anyway. So, yeah, that's, so Friday was the exam, and then I was busy that day. Examining results, and I was busy that day. When I got home, did the coaching, but I was really tired. As soon as we were done, I just went to bed. And then the next day, I had to continue working. Did some rounds, and then I played a little bit because I just wanted to play and de-stress, and then I was going to rest, like sleep, because I was planning to stream Tekken, right? I was planning to stream Tekken that night. And as soon as I tweeted that I'm going to stream Tekken, like few minutes after that, I got a call for an emergency surgery. So that's why I had to cancel that stream, because I was really tired. I was like, oh my god, I wanted to rest. But no, there were other plans for me, unfortunately. Sharing up on link ng Discord. Anyway, someone give him the Discord link, because I don't. I unfortunately don't have bots on stream elements on my YouTube channel, so I don't have the. So anyway, what was the emergency surgery? As soon as I got home really late after that emergency surgery, I like past 12. I was so tired. Like, as soon as I got home, naligo ako kasi kailangan maligo. And I was so tired. I was like, dead. And then Sunday, I just wanted to be normal and not do doctor things. I just wanted to be a normal human being. That is just be a normal person that is not non-doctor thing. So after I did rounds, I was like, I don't want to do I was like, please do not call me anymore. Anyway, what surgery was that? Okay, so the surgery that we did, well, actually, it wasn't just one surgery. Like the past week, like I said, we had several surgeries. Okay, I had several surgeries, and then the one on Saturday was more major surgery. The other surgeries I did they're considered minor, kinda, but they both had the same diagnosis. They had the first surgeries have the same diagnosis, but one is more toxic than the other. Gallstones are not really emergencies, not typically. They were cases of abscesses. They were cases of abscesses on the back. Like, when you have a tigyawat or some boil at the back and you just leave it there and it just grows and grows until it becomes a monster at the back on your back. That's exactly what it was. Toxic meaning like it's our slang. It's the medical slang for like bantayin. Like toxic meaning like you really this guy is you really have to watch this. This guy can go get worse. Something like that. Bantayin. Babantayin mo siya kasi pwedeng lumala. It's really bad. It can mean like toxic in the medical field can mean like getting a lot of patients. You will never rest. You're gonna be guarding that this patient is not benign. Yes, many problems that you have to watch. The types of patients that are like really emergency that you gotta do something. It can be like a stroke patient, a heart attack patient, something like that. That's what we mean by toxic. If we say toxic, it just means you're gonna have a bad day. Pretty much you're gonna have a bad day. I have a toxic patient, meaning this patient has a lot of diseases and it's gonna be really bad unless you have to watch this patient. Daming nangyayari, mga ganon. This duty is toxic, meaning it's so busy that you can't even rest or eat. That's what I mean by toxic. We can even say toxic ng consultant o toxic ng doktor na yan. It means that doctor is an asshole. Or yung tipong yung gago. Pwedeng toxic. Yeah, it can be. Like, toxic yung relatives nun. Toxic yung relatives ng pasyente. Meaning the relatives are really hard to deal with. Something like that. They are really hard to deal with. It's basically what I mean. Anything that's just like horrible experience. That's it. Toxic. When you say toxic yung pasyente, by context, it can mean he has a lot of diseases or his personality is just annoying. You know what I mean? That's something like that. Toxic as in league play. Pwede rin. Yung ugali ng pasyente tsaka yung relative, parang league player. But anyway. Yeah, so two of my patients had abscesses on the back. It starts as a boil, a tiny little tigyawat on the back that you leave alone. Wala kang ginagawa, may tigyawat ka lang sa likod, tapos biglang lumalaki. Grows and grows until it consumes your entire back. That's how bad it was. Except one of them was not really the entire back, probably like a third of his back. The other one's like freaking 3/4 of his back. It was disgusting, man. I was like, what? I was like, oh my god, why? In my head, I'm like, why did you guys let it grow to be like this? Why? Bakit nyo hinayaan to? Tigyawat lang, tapos naging ganito. Taong boil, no? Parang yung tigyawat na tinubuang tao. It's crazy. Purulent? Oh, yeah, definitely. Definitely. No one would believe that I'm watching the stream while somehow trying to make dinner. Oh, that's okay. If you're in a medical field, this is normal. I can talk about these things while eating. Cancers? No, it's an infection. It's an infection. It's not a tumor. It was like it's literally just a boil that grew so big. It's eating his flesh, you know. So those things can get really toxic in a way that you have to operate. You have to bomb them with antibiotics, and then you have to operate to release the pus. Because if you leave it in there, it's gonna get worse. So one of them has a smaller one, but it's still big. He's doing okay so far. But yeah, he's doing okay. After the surgery, he did better. He's doing okay. We just need to keep cleaning his wound. Because when you do a surgery for a huge abscess like that, you can't close the wound. You have to leave it open. So considering that it's a very large abscess, so imagine having a big incision on your back and you can see the flesh inside. You can see like whatever is inside underneath the skin. You can see it. And he's doing better now. We just need to complete the antibiotics. Does it also stink as heck? It depends. It depends. Some don't really smell that bad. Some do, though. Some others do. It smells terrible. Some are okay. Like, they don't really smell. Others smell bad. The other guy, though. The other guy with the larger abscess. Though, after the surgery, or not even after, during the surgery, he was getting hypotensive. And I was like, holy shit. Why is he hypotensive? Why is his blood pressure going down? So I was thinking maybe it's the blood loss. Because syempre infected wound, infected area, and it's a large area. It's like a large portion of his back, right? So I was like, I told him to get the blood and transfuse him. And we were able to raise his blood pressure a little bit, but he still had low blood pressure, and actually that patient is in the ICU. So that's another addition to my stress, because I have a patient in the ICU. Caused by, I don't know. But then, after a few days of watching him and checking his, regularly checking his blood test, his hemoglobin went up, so at least I know that his hypotension now is not because of blood loss, but it's really more on the infection, because the infection in his blood, the WBCs are really high. So I'm like, okay, we are fighting a big ass infection, because it was so high, man. I was like, what the freaking hell? And I'm like, oh my god, okay. So I had to explain to the resident, because I'm not a resident, I'm a consultant now, and I have to be the one teaching them little residents, the little baby residents. So I had to tell my resident to, like, you gotta watch this patient, okay? You gotta watch this patient, because this patient is not, he's going to go in shock, okay? It's not hemorrhagic shock, since his hemoglobin is doing better. but his WBC is going high. So this is a septic shock, okay? So you gotta watch the patient. And true enough, because of the infection, okay, because of the infection, in septic shock, or yeah, septic shock, sepsis, septic shock is very, very devastating if you don't treat it right away. So that's why when I found out it was septic shock, I was like, okay, you better make sure he gets his, you guys better make sure he's getting his antibiotics regularly, because if we do not control this infection, he's gonna go kaput. But he was starting to have signs of some organ failure, actually, like his kidneys especially. He was not producing enough urine. Because when you have sepsis, when you're in septic shock, thank you for the membership, SwitchCon. Thank you. Referred to infectious. That patient's definitely referred to infectious disease. He's definitely referred to the infectious diseases, man. I'm not doing this alone. I'm involving them. I'm involving infectious disease, man. Ilang taon dak si patient? He's let's just say he's in the middle age. He's middle aged, okay. Definitely with diabetes, because you don't get shit like that without diabetes. You rarely get stuff like that if you don't without diabetes, man. But yeah, so his kidneys were starting to, not really fail, but there was a kidney injury. When you have septic shock, one of the first things that are going to be affected are the kidneys. Like when they pee, it's only a few. So that's why we put a Foley catheter, so that we can monitor the urine output. But yeah, and he would pee very few. Like his urine is very few for like an entire day. So I was like telling the resident, like, really just hydrate this patient properly and inform internal medicine and infectious disease about this. Like, make sure they're helping to treat this also. I refer to nephro. No, I don't think we need. I did not refer to nephro, because he doesn't. I don't think that patient needs a nephro, because we already know that the source of that is the infection. So really, what we have to do is control the infection and make sure the blood pressure is high enough. So he was hypotensive for some time, and of course they had to start the patient on what do you call this, on vasopressors, norepinephrine drips, so he's still in norepinephrine drip. Dialysis is what I know. Actually, I was like I told my resident, like, if this patient's urine output does not improve and his serum creatinine still goes up, like, we might have to do a dialysis. I was like, we're gonna have to refer to nephrology and then do a dialysis. But I think he's doing better now. He's doing better now. So I'm like, I think he's doing better now, because they titrated his norepinephrine, and his drip is less than before. So, and his urine output is a lot better now. So we'll see. But the wound, the one where the abscess is, we still have to treat it a little more. So yeah. It's crazy. That patient is the one I've been worried about for ever since I did surgery on him. Like the past few days, I was like really watching that and making sure the residents like update me about this patient, because it's worrisome actually. But yeah. Yeah. Watch your sugar intake, people. Exactly. Yeah, you know, pag may tigyawat kayo sa loob, okay, ay sa loob, sa likod. Pag may tigyawat kayo sa likod, chat, if you notice na may tigyawat kayo sa likod, if you have a boil in your back and you notice it keeps growing and growing, please see your doctor. Do not wait for it to become a freaking giant monster on your back, okay? Don't wait for it to become don't wait for yourself to become a hunchback because of that, okay? My God. Madalas na may tigyawat sa likod. Oh my God, no. Iba naman yung maliit, no? Like, if you notice it growing and growing, then please see a doctor. Wag naman paubutin na yung buong likod mo kinain ng tigyawat, eh. Parang gusto ko maging Hunchback of Notre Dame. Bahala ka sa buhay mo. Gusto mo maging Hunchback of Notre Dame. Huwag ka na magpakita sa doktor. Oh wait, here we go. Let's see. I think I got an update from our resident. Hold on. Oh no, this is a different one. Okay. What's this? Pag may tigyawat ako sa likod, pinapatiris ko pag may mata na tapos pinapabidyohan ko parang kaki. Okay, so, oh, Leonard, hello, yeah, hello. Alright, so, yeah, those are my two, surgeries. Now, we're gonna talk about the last surgery that, caused me to cancel my Tekken stream last Friday. That one is actually a major surgery. Okay, that one, the one last, not Friday, Saturday, that caused me to cancel my Saturday Tekken stream. I was really excited to play because I haven't played Tekken in a while, like in more than a week. So, oops. Australian, thank you for subscribing. Welcome to the stream. So I got a call Saturday after I posted my, announcement that I was gonna stream Tekken last Saturday. I got a call, like a few minutes after, I got a call from saying that there's a patient who's obstructed. The patient's like a young dude, and he couldn't pass gas for like 4 days, and then his abdomen was distended, like growing, and he was in pain, he was vomiting. So he went to the ER, and they did an x-ray in the ER, and they saw that his bowels were huge. Okay, and wait, I'm just gonna show you a representative image of the x-ray. Actually, come to think of it, I think I talked about this. It's a case I talked about before on stream. X-ray. I'm gonna show you how the x-ray kinda looked like. It's very typical. If you see it, it's very typical of this kind of case. It's a good one. These are ugly. What the heck? These are ugly representative pictures. Wait. I need a good photo. Ang pangit nito. These are ugly. Pangit naman ang wait. Okay, this one. There we go. I think this is a good one. This would be a good one. How do I open image new tab? This is a good one, I think. Oh. Alright, this one is a good one. Alright, it looks something like this. Hold on. How do I? Where is it? Okay, it looks like this. There we go. Can we zoom this? There we go. It looked like this. Okay, it looked like this. This is how the X-ray looked like with the arrows. So when I saw this, I'm like, oh my god, yeah, this is a surgical abdomen. I'm like, oh my god, or not really surgical, but something has to be done in an it's an emergency. This is an emergency X-ray. So let me explain this. Okay, you see these arrows? This one. This thing is called a coffee bean sign. We call this a coffee bean sign because it looks like a coffee bean. Okay, it looks like a coffee bean. So when I saw this, the X-ray looked like something like this. Okay, it looked something like this. But... So I said, "Are you kidding me, bro?" Because this is a sign when you see this in an in an abdominal X-ray. The number one consideration we think of is a sigmoid volvulus. Okay? A sigmoid volvulus is when your sigmoid colon twists on itself. And this is what you see. This is the sigmoid colon being twisted. Let's see. There might be a nicer picture around here. Let's see. Sigmoid volvulus. I talked about this. I think I've talked about this before. Here we go. This is a nice one. Here we go. Image nuke that. All right, here we go. This is it. Here we go. There we go. Nice image. There we go. This is part of the large intestine called the sigmoid colon. Okay, and then it twists on itself. So this is a sigmoid volvulus. So if you look at this X-ray, this loop right here, this loop right here, oops, this loop right here is pretty much this right here. Yeah. So colon. It's a large intestine. It's a colon, sigmoid colon. Okay, sigmoid colon. So yeah, this is what happened to it. The sigmoid colon decided to twist itself. So when I saw this, I was like, oh my god, this is an emergency. It definitely is this definitely is an emergency. Something has to be done. And what is so usually okay, so usually paano na twist yung colon? Okay. Sigmoid volvulus is usually in people who have anatomically long sigmoid colon. So if you look at the colon, normal colon. Okay, here we go. Let me show you guys. There we go. Look at this. Okay, guys. Okay, guys. You see this? This is the normal colon. Okay, this right here, and then this is the volvulus. So normally, so this over here, this is your appendix. Okay, I don't know if you see my mouse. I don't know if you see my mouse, but this is the appendix over here on the. And then the part of the colon that goes upward like this is the ascending colon, and then transverse going across is called the transverse colon. Going down, this one is the descending colon. And then this one, this segment right here that goes up halfway across is the sigmoid colon, okay? And then this is the rectum and then the anus, okay? So you get a volvulus usually if your sigmoid colon is longer than usual. So there's some people who have really, really long sigmoids to the point that it reaches this side. It just loops around. It's like you have a long ass sigmoid colon that it just when you're walking around and it's just hanging there, nakalawlaw lang dun, and then eventually just twists on itself and it becomes volvulus. That's what happens. So it's usually on people with long colons, long sigmoid colons, yeah. So yeah. So when I saw that, I was like, no, emergency. And then I told a resident to. I asked, one of the first things you do in a sigmoid volvulus is you assess the patient, and if the patient is, usually some hospitals would request a CT scan. Okay, if it can be done right away, a CT scan will be done. And from the CT scan, you can see if there's you can see it more clearly. You can see it more clearly, like if there's an inflammation or stuff like that. You can see if the bowel is dying. Okay, and in this case, yeah, a CT scan was done, but there was no reading yet. So the resident placed a tube. But we usually the first management we do on a sigmoid volvulus is to detort. We call it endoscopic detortion, wherein you put a tube or you put a scope in here and then try to unravel this with a scope. Sometimes we put a rectal tube. We put a tube in there and try to unravel this. But you gotta make sure that when you do that, it's not a dead bowel. Okay? Yan ba yung nararamdaman na namimilipit sa lower left of the body, or is it right na minsan isip ng iba is hernia? Not really. It depends. Abdominal pain is very vague. It can mean many things. So it really depends on like the history, the physical examination, the X-ray. This patient was diagnosed with sigmoid volvulus because of the X-ray, because it showed the coffee bean sign in the X-ray. So a rectal tube was placed, but then nothing happened. Nothing happened. That's what I was told. So, and the patient was tachycardic, so the heart rate was already high. He was already, starting kinda to be unstable. So we scheduled for an emergency surgery. And as soon as we opened up the patient, bro, this loop of bowel here was freaking just, as soon as we cut open the patient, the loop of bowel just sprung out like a balloon, wanting to come out. Like a freaking loop of bowel just said, "Hi, hello, it's me. I am the sigmoid colon." But you know what? This guy's lucky. The patient was lucky because that bowel was not dead. It was not ischemic. It was actually still alive. It was actually still alive. And I was like, yo, this guy be lucky. He's just obstructed and not, it's not strangulated. But it was huge. Like, inflated like a freaking balloon. Lumuwa na lang yung abdo. Abdo? This is the colon, not the gallbladder. This is the colon, not the gallbladder. This is far from a gallbladder surgery. This is a colon surgery. So, the bowel just sprung out, and we untwisted it. And yeah, we discovered, and true enough, his sigmoid colon was so long. It was freaking long. It was long as hell. So, and we were lucky. He was lucky that his bowels were not dying or dead. So, while we were exploring, like, syempre, it was an exploratory laparotomy. So we unlooped the bowel and then we explored a bit to see if there's any other problems. We saw a few adhesions which we released, and then the entire time we were exploring, I was looking at the patient's vital signs, and he was actually doing pretty good. He was stable. And we had some reserved blood. So the decision was the treatment for a sigmoid volvulus. Okay, a treatment for a sigmoid volvulus is actually to shorten the sigmoid. So you have to resect. That's the treatment of a sigmoid volvulus. Now, in an emergency setting, if the bowel is dead, you have to resect that part of the bowel that is dead, and then you have to do a colostomy. So, but in this guy's case, the bowel was not dead. His sigmoid was long as hell, and he was stable. So, we did resect just to shorten his bowel, and we did an anastomosis. We reconnected the bowels. Okay, he was stable. Yeah, that's a treatment for volvulus. You gotta shorten the bowel, the sigmoid, and then depending on whether the patient is stable or not, you do a colostomy or you can do an anastomosis. Anastomosis is basically reconnecting, like tubes. So that's what we did, and he tolerated the procedure pretty well, and he's still in the recovery phase. So yeah, we're just watching him closely, and hopefully he'll be doing okay after. I went home late because of that surgery. Makes sense. Kailangan bawasan pa rin ni ulit umikot. Yeah, that's the treatment of volvulus. There are other treatments for sigmoid volvulus, but they're kind of outdated. Some surgeons still do it, like they do a sigmoidopexy, wherein they suture the sigmoid to the side of the abdomen, but the problem with that is that it can recur. The volvulus can recur again. Yeah, it can recur again. So that one's not really done. Not much. I don't know. Some surgeons still do that. I guess it just depends on. I don't know. It's their judgment call. But yeah. So hopefully the patient will do well. He's still recovering, and we're still watching him and making sure that he will be okay, because after a resection like that, I don't feed patients until like the 4th day or on the 4th day or day after, because you gotta make sure the healing of the anastomosis or the connected bowel is good. You don't want any any feces to be passing there. Baka bumigay. So yeah, he's not eating for a few days. So yeah, Isaw, yeah. Isaw. But yeah, that was it. And then yeah, that's the surgery so far. That was that was the surgery so far. And all my patients are still admitted, so it's kind of stressing, especially the one who's in the ICU. It's kind of stressing because I gotta make sure he's doing well. Gotta make sure he's doing well. Maybe I can show How's post-op anastomosis inspection? Is it through x-rays or endoscopy? Oh, we don't really inspect the anastomosis directly. We go by signs and symptoms. Like, how do we know if the anastomosis is good? That's why we do like an observation for like 4 days of him not eating. 4 days of not eating, and we watch the vital signs. Because the signs of a leak, an anastomotic leak, one of the signs is tachycardia. Okay. Tachycardia, or a fast heart rate, and then they become febrile, they start having fever, and then they complain of abdominal pain. They complain of abdominal pain. But one of the first signs is tachycardia. So if the patient's tachycardic on the 4th day, that will raise some flags. So we're gonna start watching him, and if he's still tachycardic, then we request. Sometimes some doctors would request a CT scan just to see if there's any fluid in the abdomen. Okay. Otherwise, some people just call to do a emergency or reopen surgery. Hindi ba siya matatawag na? It is a major surgery, as I said a while ago. It's a major surgery. Oh, hey, look! I found a nice picture of a sigmoid volvulus, like an actual picture. So, guys, I'm gonna show you exactly how the sigmoid looked like when I opened up the abdomen and it just decided to say hello to me. This is a nice picture of it. Expect some gore, guys. How do I zoom in on this? Time for some gore. And here it is, guys. Pew! Look at this! Look at this sigmoid! It looks like this. I found a nice photo. Look at this. Look at how balloony. Look at that. Look at that twisted sigmoid. This is actually how it looked like. Buhay pa to. This sigmoid is actually still alive. It's not gangrenous. This is a healthy, not really healthy. It's not supposed to look like this, but I mean, at least it's still alive. Parang balloon. Yeah, it's a balloon. Okay, I don't want to show it too long. Okay, so there we go. Yeah, that's basically how it looked like. It was like a big loop of bowel. Parang jellyfish. Jellyfish? What? How is that a jellyfish? Anyway. Neck pillow. Is the resection usually done like from the points of intersection of the volvulus? If it's a dead bowel, if it's a dead bowel, it depends on the arteries you are ligating or cutting. Because when you resect the colon, when you resect a portion of the colon, you have to cut arteries. And the sigmoid colon has a lot of arteries. So sometimes the first thing you do before cutting the bowel is to tie and cut arteries in the sigmoid colon. And when you tie and cut arteries in the sigmoid colon, part of the sigmoid colon is gonna darken. So you know that part of the colon that's darkening is the part of the colon that needs to be resected, right? Or at least it gives you about the boundary of your resection. So if let's say we're dealing with a gangrenous sigmoid volvulus where the bowel is dead, right? You're going to resect that you untwist that bowel, the bowel, and then you will resect that segment of the bowel with some of the live one, with a part of the bowel that is still alive, because it depends on what arteries you are cutting. Now, if it's a sigmoid volvulus where the bowel is still alive, it makes it actually it's easier. You just make sure that the sigmoid, that your goal is to just shorten the sigmoid, so you can resect as much as you want, as long as when you reconnect the bowels, like say you're gonna remove a segment, right? When you reconnect the one end to the other end, there shouldn't be any tension. So it has to be kind of loose. There shouldn't be any tension. Okay? Parang newborn. That is the hell, bro. Parang naging newborn. Let's see if there's a photo of resection. There's gotta be a photo somewhere around here. Oh, there is no photo. There is no photo of a resection. And yo. What's this? Doc, I'm a first-year computer engineer student. I can't remember when was the last time I slept. Can you give me advice on how am I supposed to manage my time, or like how do you you haven't slept. You gotta, let's see, how to say, how to manage your time. That really depends on what your schedule is and what you do in a day, Just drink Monster. He wants to be able to sleep, you guys. Sometimes all you gotta do is get rid of some distractions, and then you'll realize that you have more time to do the things you need to do. Sometimes it's just getting rid or lessening the distractions in your life that gives you the time you need to do whatever you actually need to do. Scroll brain rot. Oh my god. Okay, the chat's telling you to drink alcohol, bro. But yeah, for example, you have you're an engineer student, right? I don't know how busy computer engineering is. I would imagine that it is pretty busy. if you have homework or if you need to do something, some work they tell you to do, you gotta do it as soon as you can, if you can, and reduce all the distractions that make you procrastinate or like slow you down, and that includes like looking at social media. Doom scrolling is one also. Okay, doom scrolling is really distracting. Looking at shorts and stuff. So what I would do is just concentrate and focus on what I need to finish first before I do anything else. First thing that my doctors advise: avoid gadgets before sleeping. There, exactly. Take out the distraction. That's basically it. Just all you gotta do is just remove the distraction, and you'll realize you actually have more time to do what you need to do. And it would help to drink like tea or something, hot tea. Doom scrolling kind of makes me sleepy. Bro, ewan ko sa inyo. I'm gonna close these voluptuous pictures. Hey, I found a photo that shows you like. Okay, wait. Open image in your calendar. Here we go. Look at this. Here we go. There we go. Look at this, guys. Here's the algorithm for sigmoid volvulus. Look at this. There we go. Sigmoid volvulus is the twisting of the sigmoid colon around its mesenteric axis, causing large bowel obstruction. So there we go. Look at that twist. Twisting, and then there. And then here we go. Patients would have abdominal distension, colicky abdominal pain, constipation kasi hindi makatae, vomiting, and there's an x-ray, the coffee bean sign, which is, this is weird. What the freaking heck is this? This x-ray is actually wrong. What in the hell? What is this? Wait, I think this thing is made with AI. This is made with AI. Yeah, this infographic is made by AI. What the hell? I just realized, because this twisting does not make sense, and this does not make sense either. This twisting on this doesn't make sense. This doesn't make sense. This x-ray doesn't make sense. What the hell? And thank you for subbing, I did not see who subbed, but thank you. This x-ray does not make sense. This is AI. I just realized. What the? And look at this! Sigmoid colon! It's pointing at the rectum and it says sigmoid colon. This is the rectum, bro. This is the sigmoid colon. What the heck? Yeah, I just realized that this is made with AI. Like, the label is wrong. What the hell is this? And I don't know what there's like a stomach in here. This x-ray makes no sense. Although, the x-ray doesn't make sense, but what it says here is right. Yeah, here we go. Coffee bean sign. And the world sign in CT scan. The description is correct, but the images are wrong. Management, endoscopic decompression. See, this is what I said. It's a endoscopic torsion, definitive surgery. There. Let me see. Yeah, that's basically it. Minadali niya ang pag-prompt sa AI. Yeah, this is made with AI. God. God, man. The guy, whoever made this, the doctor who made this should have at least checked what is this, bro? Look at this. His colon is like attached to this weird. It's freaking weird. Oh God, this looks so wrong. Okay. Save bowels, save lives. Yeah. Okay. Bro. Okay, that is a horrible. I was like, oh, this is a good infographic, and then after close inspect, I would say. And I even said, this is a good-looking infographic, but then after close inspection, I'm like, wait, there's something wrong here. There's something wrong. This whole thing, the images are wrong. Oh my God. Is there a better-looking infographic, though? How about this one? Open image. Oh, it's too small. Never mind. Naging alien yung anatomy. And before I forget, another advice that my doctors told me to have better sleep quality is to exercise. Sounds boring, but any physical activities and hobbies that can tire your body. Yeah, that's true. That is true. That is true. God. Okay. You know the thing with doctors, the thing with AI. Let me say this now. The thing with AI in medicine, AI is actually, it's a different world. Let me say this, okay? As a VTuber, as someone who is a VTuber and is a doctor, two different worlds. AI, the use of AI is generally accepted in the medicine world. Actually, they use it as a tool. So, like, for example, making that horrendous infographic. The stuff that is written in the infographic is correct, but the images are alien. Like the stuff, the information that is written is actually correct, but the representative images are stupid and wrong. But anyway, in the medical field, AI is generally accepted because it helps them, when they make presentations, they use AI to make representative images, right? And it's also a tool to help them search information faster. Yeah, in corpo it's accepted then. Yeah, that's true. But yes, even as us as doctors, if we're gonna use AI as a to search for information, we double check the information that is given because it can be wrong. It can be wrong. Now that's in medicine, right? And even in corpo, we use it as a tool. Okay, we use it as a tool and not really a replacement for anything. Because even as doctors, human is still better than machine, But what they're doing now in medicine is trying to how to use AI to help or to improve how to improve medicine. It's basically it's being used as a tool. Now, unlike in and then on the other side of the spectrum where I'm a VTuber, right? AI is very much looked down upon, which is understandable because as a VTuber, you rely on art. Yes, you rely on art, and art is best done by people instead of AI, right? And yeah, what you say? Even in I think I don't know if is there like AI rigging already? I don't know if there's AI rigging. I think there is though. I'm not sure. But in VTubing, content creation, anything that uses art, yeah, like a lot of artists really hate AI, which is understandable because AI is used as a shortcut for some people to get art, and it's an insult to artists. To be honest, if you want an artwork, it's best to just commission an artist. Even me. If I was gonna, I would prefer a human artist over AI because AI generated art or whatever it's bad. it's I mean just look at just looking at the infographic earlier, like you tell AI to show me the colon and a sigmoid volvulus, and it gives you an alien. It gives you this ugly thing, man. It gives you this, okay? This. It is so stupid. But you see, in the medical field, if you need representative images for your slides or for your report, AI is the fastest way. Because if you're making a report, the report is actually for more information. It's not to promote the art or the image. It's to spread more information about whatever you're talking about. So even as a doctor, when you're making your presentation for conferences, you don't commission an artist to draw you a colon. Sometimes we draw the colon ourselves, but some doctors can't draw for shit, so they have to use AI. But the point is, we're just trying to get the point across about the topic we're talking about, and it's not about the image or the photo or the picture or the art or whatever image you're making. It's about the entire topic. Creative fields, you must not claim it's your work if it's yes. How about using a real example for presentations? Yes, okay, Pokari, about that. If the doctor is presenting a case, okay, if the doctor is presenting a specific case, especially if it's a case that they did, they use pictures. We take pictures of our case. We take pictures of for example, if it's a sigmoid volvulus, we take pictures of what we see. We take pictures of the bowel, of what we did, of the before and after. They do that. But if it's let's say they're reporting about something, that is, even if you Google for images of it, it is not available. The exact thing that you want. The exact thing that you want is not there. They use AI, something like that. With consent from yes, there's always consent. And if there is a case being presented, we don't show the name or the face of the patient unless it's unless the case is a involves the face. But if it's like something like sigmoid volvulus where it's the abdomen, it's only the abdomen is seen. Hmm. Speaking of AI, I have an intern ask on how we did our codes without AI back when I was in college. You raw dog, telling you raw dogged it. raw dogging the codes. AI generated the bolts. Oh my god, I don't even want to know how that looks like. Hey everyone, hope you're doing okay, Shiori. I'm doing okay. Hello Fukumi. I'm good. So yeah, it's like a different world. When it comes to AI, it's a different thing. Like in VTubing, AI is very, very, very extremely frowned down upon. But then in my work, it's not. It's really not. So me when I'm doing VTubing related stuff, I keep AI out of it. But when I'm working, like in real life, I don't really use AI that much as a doctor, to be honest. Not much. Even with images, man. If I'm gonna make like an infographic with images, I'm not gonna use AI for the images because I know that the images from AI is gonna look so shitty. I really take time to look through Google for some images. The only time I will ever use AI is if I can't find the specific image I need. Hot take, AI lang si Doc at nasa Matrix tayo. Bro. Doc, I hit the sheets na maaga pa tomorrow for work. Gonna rest up kasi grabe toxic ng boss kung weird na sobrang presyo. Okay, have a good night, makinput. Hindi mo wala ka sa paan ni Rian. Hotter take AI lang tayo sa chat ko lang kausap actually si Doc. Gagi! Oh my god, I've been talking to myself the entire time. You guys are my imaginary friends. Alright. Okay. So yeah. Really different worlds. Really, really different worlds. But yeah, I know even like I think Fat Master said it, even in corporate AI is very much well accepted. It is. I think when it comes to corpo and stuff like that, I think it's okay as a tool, but if you're gonna in my opinion, if you're going to make promotional material out in the public, promotional material out there in public, or posters especially, okay, posters, it is much better to just hire someone to do that for you than to use AI, because even in surgery, okay, even in the medical societies, like recently the surgical societies right now, they're making posters of like certain conferences, like join or attend this conference, yada yada yada, and they use AI to make the posters, and I see the posters and I'm like, oh my god, it's so ugly. Ang pangit the poster, halatang AI. I'm like, why did you guys just get someone to just make it? It's better if a person makes it themselves. Don't use AI for this. Ang pangit talaga. If promotional material should not be AI, guess mawawala ng spirit of promotion. Yeah, well, unfortunately, you see, since in the medical field, AI use is very much well accepted. They just use it and no one cares, except maybe the ones who care are the ones who are, you know, artistically inclined. Like, I do have friends who are doctors and artists, and when they see the AI posers, they're like, oh my god. They get triggered. They get like, it's so ugly. Like, why can't you make my mga artist na ano, ba't ka nag-AI? Bakit ka nag-AI? It's so crazy. It's so ugly. It's so ugly. It's so ugly. I frown upon using AI for chat support on Quickly. Oh my god, speaking of AI chat support, even in the medical field, they're starting to use that actually. Like, in the last conference I went to, like, they were promoting AI bots. Like, using AI bots for your private practice or for the hospital. So when a patient inquires, the AI bot's just gonna streamline it for you, answer their questions, something like that. I was offered that, but you know, I was actually considering using that because I was overwhelmed. You know, I have a professional page, right? I was overwhelmed with some stuff, so I was like, should I? And then when they introduced that to me, I was like, and then they showed me, and then they told me the price. I'm like, nah, what the heck? Ganyan kamahal para gumamit ng AI para lang makausap ng pasyente. I'm like, nah, never mind, man. I'm just gonna allow myself to drown in all these patient inquiries. Malulunod na lang ako. I'd rather drown in all these inquiries than spend for this. Like, forget it, man. Forget it. I think the problem is that normies don't usually know where to hire actual artists for the ads and that. Yeah, there are a lot of doctors who are artists or like know how to use, you know multimedia arts. They know how to do stuff. They know how to make posters. There are, and they could have just asked those doctors to do it for them. Instead of AI, so I don't know. I don't know. I think it's a boomer thing also because most of the people that's like up there in those societies, the heads of the societies, they're old people. They're mostly old people, so they probably, they're like, we can just we use AI, it's easier. We use AI, it's easier. Let's do this. So yeah, it's nothing we can do about it. We can't really do anything. We can't really do anything. We as the younger doctors, we just see this, the ones who are artistically inclined, we just see it and we're like, oh my god, this is so ugly. It's an ugly ass poster. Why? We are just like, why, bro? Why? Millennials and Zoomers just use AI for memes and shit posting. Yes, yes. No, but there are some millennials and Zoomers that use AI because they're lazy. They still exist. They still exist. The boomers use it because they don't know any better. Okay, they don't know it. Even my mom uses AI. My mom uses AI. So I'm like, okay, I guess it's really just it's a boomer thing. Wala akong magawa. Yung mom ko is engrossed in some mga AI web. Oh my god, those AI, those vertical dramas that are AI? I have been seeing those. Like, sometimes I do watch vertical dramas. you know, because they catch my attention. But then the ones that are obviously AI, it's horrible. It's terrible. There's like no, you know, it made me, you know, I used to think the actors and actresses in those vertical dramas were horrible actors and actresses, like they can't act. But then when I see the AI versions, and I'm like, oh my god, I think I judged these actors and actresses too harshly, man. This is even worse. This is even worse. It's worse. My mom has been watching those AI dramas too, and you know, I just hear it. I only hear it. Sometimes I hear it, and I'm like, Mom, that's an AI drama, isn't it? And then I look at her screen, and I'm like, yeah, it is an AI drama. I'm like, they have no feelings in their voices. Like, I started, you know, because of that, I started appreciating the actual vertical dramas without that don't use AI. The ones that are using like actual people for acting and you know, acting. What's this? Woke up at 10 p.m. kanina at same time rin ako tuned in. Hopefully maging okay na yung picture. Thank you for the super chat. Thank you. And hopefully he's okay. Hello Rambo, John. Hello. Boses pa lang alam na naman eh. I know, right? It's crazy. I could appreciate Dharma. Yes! Oh my god! You know, you appreciate Dharman way more after seeing all those AI shit, man. Dharman. You know, I watch Dharman. I do watch it when I'm bored, when there's nothing else to do. Or yung tipong nasa, yung, alam mo, yung nasa banyo ka lang, bored ka. Tapos manonood ng Dharman. Dharman. I watch Dharma dramas. At least the actors and actresses there are putting in some effort. And then you see AI and it's like, oh my god, this is so shitty. Doc watches Dharman videos. Yes, I do. I do when it pops up on my feed, then I do. And then, you know, when you watch one and you watch one and then they suddenly all start popping up in your feed when you scroll. Hindi na uubo, so I ended up watching more. I just said, wait, Tekken Goon? What is this name? Thank you for subbing. Tekken Goon, what the heck? We got a Tekken Gooner that just subscribed to me. Oh my god. You ruined your algorithm, I still can't appreciate Dharma dahil parang Pinoy telenovela ang quality ng story. You need to watch there are some Dharmans that are good, actually. The one about the Nike story was actually a good one. I enjoyed the Nike one, the Nike story. There was one about Nike. I enjoyed that one. The rest are like the same story, just different actors. Baka naman Gunasin yung minion ng lumang movies. No, he's definitely a Tekken Gooner. Definitely a Tekken Gooner. And to that Tekken Gooner, to Tekken Goon, if you want to watch me play Tekken, I actually have two days where I'm gonna stream Tekken, and that's Thursday and Saturday, 9 p.m. Philippine time. I actually scheduled 2 Tekken streams this week, guys. Because I'm like, okay, before I start playing any other new games that are like, you know, story heavy or RPG, I'm gonna play some Tekken first. And, you know, I actually scheduled Idol Showdown also tomorrow. Nice transition to the schedule. Yeah, because it just reminded me of Tekken. Duck just a question. Why is it that when I catch a cold, the next day I have fever? Is this just me or it happens to everyone? That is a cold thing. When you get a cold, you can get fever. It's the usual. It's a usual cold, a flu thing. Road to GOD 1. Actually, it's gonna be road back to GOD because I demoted. I haven't played in more than a week, so I'm still at TGS. So, yeah. I hope I get back to GOD. Did you see a Bob trailer? Oh yeah, I did. You know, Bob used to be someone I hated playing against in Tekken 6. Like, I hated playing against Bob in Tekken 6 because he moves so fast. He's like chunky and then moves fast. He's a chunky ass character and moves like freaking like a freaking woman. You know? He has the agility of a woman, so it's annoying. Madaming Steam sale ngayon. Oh right, there is, right? There is. Did you buy anything in Steam sale? No, I did not, because I didn't have time to really... I didn't have time, I was busy. The entire, you know, past week. Like, super busy. But I was gifted some games. I was gifted, wait. I could probably play some of them. I was gifted some games also. From Sir Wheatbread. He gave me a Jesus game. That reminds me, I want to play that. He gave me a Jesus game. Wait, where is it? I think it's I Am Jesus Christ. Yeah, he gave me I Am Jesus Christ. So we can play this. We can play banal stream, guys. Banal stream. We should have a banal stream. I Am Jesus Christ. We will play this. We will have a banal stream maybe next week. Okay, we're gonna have the banal stream. And then he also gave me what is it? Deltarune. He also gave me Deltarune, but I think I will wait for Deltarune. I think hindi pa tapos yung mga chapters, so I'm gonna wait until all of that is done before I play Deltarune. I don't wanna play Deltarune yet. I'm gonna wait for everything to be done before I play. Save it for Holy Week. No, we gotta play it soon because all of you gotta confess your sins. Get well soon. Oh, hello, Tekken Goon. I am already good. I'm okay. Save it on Sunday. I actually don't have a stream scheduled on Sunday. Do I? No, I don't. Maybe we could. Maybe I can do a gorilla stream on that day. I didn't schedule anything. I didn't schedule anything because I was thinking if I wanted to rest on that day or not. So maybe Sunday night. We'll see. We'll see. Teach me Xiaoyu. Teach me Okay, I'm gonna be streaming Tekken on Twitch this Thursday and Saturday. Okay, so I have 2 Tekken streams this week because I need to get back to playing. I haven't played for more than a week, so. What's this? Okay lang kahit di mo nakapag-stream sa ng Sunday, pahinga mo lang yan. We'll see. Non-ShioriPon. Banal Street. We'll see. Okay. I also have I just want to play some of these games before we do another RPG. Cause yeah, I have so many games. Holy crap! We should do a horror games. We should do a horror game stream soon also. ShioriPon. But yeah, I haven't really bought anything for myself yet. Is there anything worth buying? Actually, wait, when is... Oh, wait, let me look at my wish list. Let's see my wish list. Where's my wish list? Wish list. Maybe something on my wish list is, let's see how much. Thursday. Thursday is Tekken Day, though. Oh my god, my armpits are here. Alright, let's see. Something on my wish list that is, cheaper. Holy crap, Beat Saber never really got a discount, man. I want to play Beat Saber. Yakuza. Oh wait, Yakuza doesn't have a discount. Walang discount yung Yakuza. Oh, Payday 3. Autopsy let's see. I'm looking at, let's see. Okay, some of these are... Some of the discounts aren't that big. Oh, Ghost Trick is 425. Oh, Ghost Trick. Ghost Trick is 25%. I know, it's 67. Oh my god, 67% off. 425 pesos na. Whoa! Mortal Kombat 1! Mortal Kombat 1! Mortal Kombat 1! Okay. Wait, until when is the sale? Until when is the sale, guys? Until when is the sale? I can't. July 4? Okay. Kung July 4, antayin ko yung sweldo ko. Okay. Antayin ko yung I'm gonna wait until I get paid. I'm gonna wait till I get paid before I buy something. I'm getting Mortal Kombat 1. I am gonna get Mortal Kombat 1. Yeah. Let's see what. Oh, Killing Floor 3, 50% off. Let's see what else. What the? Some of these are not. Hey, nice day for fishing. Nice day for fishing, ain't it? Oh, it's on sale too. Nice day for fishing. It's the game of Viva La Dirt League. I am cat. Ooh, Final Fantasy 7 Rebirth is 60% off, but it's 1,000. I cannot afford to buy games more than 1,000 pesos. I can't afford a game that's more than 1,000 pesos, but I do want to play Final Fantasy. Final Fantasy 7 Rebirth. I want to play this, but I can't afford games. I can't afford this. Not over 1,000, man. Put up that. Malian. Yeah, I know. I want to get the Final Fantasy because I I only played the first part and I wanted to play this. I want to play the second part. This is the second one, right? Yeah. I haven't played it yet and I want to. Ooh, Split Fiction is also on sale. But it's still expensive. It's 26. 26. Oi! Romance MD. Oh, the otome game with doctors is half price. Baka bumaba yan after. Yeah, but I want to play it before Revelations comes out. We gonna play Split Fiction with Doc. I don't know. I'll see. Maybe Rion. Death Stranding. Ooh, Date Everything is 390. Oi! Mortal Kombat Legacy Collection is on sale also. Dying Like the Beast? Oh, this one is only... No, it's still expensive. Still expensive. Oh, the Kingdom Hearts games are on sale too. But there's so many games I want, guys. Little Nightmares 3. There's so many games I want. Back. Cure, a hospital simulation. Oh, Dino Crisis 2. This is we should, you know what, I am going to do like I should have like a week or something where I play retro games. Bum Simulator. Oh. Gambling with friends. Gamble with your friends is they're 153 pesos. Huh. Okay. Okay. Ang laki ng sale. Okay. Saying that I need to prioritize. I think the first thing I'm gonna get is the cheaper ones. I want Final Fantasy, but I'm gonna the number one thing I'm gonna get is Mortal Kombat 1. Doc, what happened to that? You were gonna show us laparoscopic suturing. I will when I am not too tired. Okay. I will when I'm not too tired because that requires me to set up the thing, the lap trainer, and everything. So I will eventually do that again. Just not now. Because I have had a tiring week, you know. Bili na games, Doc. Baka maban yan kasi too violent. Oh my god. Yeah, I remember that. Yeah. Oh my god. That actually pissed me off, you know, when I saw that they wanted to ban violent video games. It's like, you guys are avoiding you guys are actually ignoring the root of the problem. Gloco said it very well. Gloco said it very well, but some people did not get his point. Apparently, you know, Gloco made a video about it, and he got shared by some pages, and they actually, I don't know, I do not understand, or I don't know how they concluded what they concluded from his video, because they just turned it into something else, and it's like, what? It's like, what? Like, bro. Bam's the only one making sense in it. No, because Bam Makino's a gamer. That's why he gets it. He gets it. So, you know, he's a gamer. He gets it. Dino Cornell also said something. Also spoke up, actually. Dino Cornell also spoke up. Bam Aquino was being very subtle about it initially. Like, everybody was asking him to say something. Everyone is asking him to say something, but, you know, he didn't really say anything outright, but he was very subtle about it. Like, his first post was with his daughter playing video games, and that was already being very subtle enough. That was very subtle enough. And then after that, his gaming page, started making statements, you know. So, Bam is he should, as a gamer, he should know that, you know, video games don't really cause violence. Not really. There's no, like, direct. It's not a cause and effect relationship. This has been disproven so many times. The thing about video games and violence, it's honestly, actually, it's not that it's been disproven. It's not that it's been disproven. It's that they don't have any proof, or it is very controversial. There is no consensus that it causes violence. There's no consensus. A lot of people researched on it. Some studies say that there is, but when you read it some more, they have, like, what do you call this? They also say that it could, you know, they will say, oh, it causes a violence, but it can also be because of some other factor, something like that. So some studies conclude that it does, but others say that it doesn't. And when you when you look at all the studies, like, there is no consensus. There's no consensus. Hindi nga nila maalis yung sugal dito sa atin, lalo na isa. There's no, like, I can look at this. What's a PubMed? PubMed is my go-to place. Video games. Actually, the best one is video games and aggression. Okay, let's see. Let's try looking. We're gonna look for some studies, okay? Let's look for a study within 5 years. And the latest one, when is the latest one? Desensitization and violent video games, mechanisms and evidence. Okay, let's open this, and stress and violence in video games, their influence on aggression. Okay, let's open this, and what else we have here? Ooh, there's a systematic video games and violence among children and adolescents in the Arab world, a systematic review. Okay, let's do that, and oh, this one's recent. Oh, yeah. Video, no. It's a good one. Is playing violent video games a risk factor for aggressive behavior, adding narcissism, self-esteem, and PEGI ratings to the debate? Okay. I'm looking for some ones right now. Yo! Competitive video game exposure increases aggression through impulsivity in Chinese adolescents. Evidence from multi-method. Bro, gagi guys, League of Legends. League of Legends causes aggression. Okay, wait, let's look at the abstract. Let's see. League of Legends. Ito na. Wait lang. Okay. Alright. Let me look at that. I'm looking at the abstract right now. Hold on. Blah 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 blah. Okay. The findings consistently show that competitive video game exposure increased adolescents' aggression and impulsivity. Impulsivity mediated the correlation and long-term effect of competitive video game exposure on aggression. Gagi, eto na. Di ba competitive rin ang Tekken, Doc? Kaya nga, di ba? Kaya ako nagmumura eh. But I'm not an adolescent, so this is adolescence. This is adolescence, guys. That means, bawal mag League of Legends ang mga teenager. Ayan, no? Ages 13 to 15 years old. Bawal mag League of Legends. Ban League of Legends. Ban Mobile Legends. Ban MOBA games for 13 to 15-year-olds. As a Dota player, my teens, I will stay silent. Ano, ha? Guys, may ebidensya dito. Okay, competitive video game exposure increases aggression in Antonio. Bawal. Ban MOBA games. Ban Mobile Legends, League of Legends, lahat yan. Oh. Ban lahat. Okay, wait. Let's see. The dark and bright side of video game consumption. Okay, we opened a lot of articles. The dark and bright side of video game consumption, effects of violent and pro-social video games. Okay, let's just go through. Let's see. Okay, abstract. Blah 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 blah. Where's the? Some studies came to contradicting results. Meta-analysis found that violent video game consumption increases aggression and decreases pro-social behavior, whereas pro-social video games have the opposite effect. Okay, so basically, this one says, oh here. Some evidence even suggests that video games consumption does not only influence the player, but also the player's social network in terms of mediating mechanisms. Cognitive and affective variables account for the effects of video game consumption on their behavioral responses. Overall, whether video games have a negative or positive influence on others depends heavily on their content. Okay, so basically saying it depends on the game. Depends on the game. Okay, so this, sensitization and violent video games, mechanisms and evidence. Exposure to violent media, especially violent video games, may cause desensitization to real-life violence. Okay. Desensitization to violence blocks empathy, which is needed to trigger the moral reasoning process that triggers pro-social responding. Let's see. Blah, 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 blah. Oh, here we go. It was concluded that exposure to violent video games increases the risk of desensitization to violence, which in turn may increase aggression and decrease pro-social behavior. Parents should be counseled to discuss the differences between real and screen violence to encourage non-violent problem solving and to provide empathy building experiences for their children. So basically, this one says yes. Well, no, it does not. It does not directly cause violence, the video games, but it will desensitize children and adolescents from to violence. They will desensitize them to violence, and when they are desensitized, they are more prone to be violent. But as long as the parents are there counseling them and guiding them, then it shouldn't happen. So something like that. So it's still a parents gotta do something. The role of parents. Okay. Stress and violence in video games, their influence on aggression. Study investigated whether stress or violent content in video games plays a greater role in aggressiveness towards a cooperative partner. While playing a video game, it was hypothesized that participants, when exposed to stress would demonstrate greater aggressiveness towards an incompetent partner than a competent partner. Wait, okay. What's up? Oh! Results indicated that provoked stress and violent content are not linked to aggression in this context. So, okay. Good. Video games and violence among children and adolescents in the Arab world. A systematic review. Okay, this one's a systematic review. Oh, look! Conclusion. In the Arab world, studies addressing this subject are limited. The discrepancy of reported results between video games and amount of violence could be attributed to the lack of standardization across studies, therefore. So basically, they don't have a consensus. They can't. Next. Is playing violent video games a risk factor for aggressive behavior, adding narcissism, self-esteem, and I don't know what PEGI is. Oh! Pan-European Game Information. Ratings. Okay. Okay, results. We found that violent video game choice is a predictor of verbal aggression alongside narcissism and hostility alongside self-esteem. A categorical regression highlighted the desire to impersonate society's undesirable role models as one of the motivations for aggression and violent video game choice. These findings show that video game violence should be considered a risk factor for aggression as in other violent media, as it provides a social reinforcement of aggressive behavior and observational learning of aggressive models, calling for an introduction of stricter online age verification procedures on online game platforms to safeguard children from violent video game content, and increased use of parental controls on content fruition. So basically, limited. Bakit specific sa Arab world? Because I think it's because the study was done in an Arab country. Yeah, okay, basically from all the stuff I just saw, from all the things I just saw, they say if you take away, from what I saw, is that violent video games do, they can lead to more aggression, but see, the thing is, as long as there is parental guidance or someone on of authority, like guiding them, then the violence shouldn't happen. It's still a parent thing. Like, yes, if a kid was just left alone to play violent, if you leave a kid alone, okay, a kid, or a teenager alone to play the violent video games, without any supervision, without any intervention, then yes, it could lead to, something, it could lead to more aggression, and it could lead to, which in turn leads to violence. But if the parent has been watching over them and controlling, limiting the exposure, then it shouldn't happen. So it's still a parental thing, you know. Yeah, there's still a parental guidance. You still have to, because kids are like, especially children. Okay, children are they're like sponges. They absorb what they see. Children are like sponges. Okay, they absorb what they see. They learn and they imitate what they see. So if they are exposed to those things without any limitations, without guidance, then they will imitate what they see. They will do that. So even so, that's, and if they have been doing that until teenage years, teenagers have they are they are going through puberty, and so their hormones are going crazy. Teenagers are pretty moody. They get moody. Okay, they are very easily influenced. So if they are exposed to stuff like this and there's no one guiding them, no one limiting them, watching over them and guiding them properly, then yes, they will end up doing bad things. What is your opinion on banning social media for under 16 in UK? Like, wait, is it in the UK? Is it an outright ban? For me, 16 years old. For me, not an outright. If it's I don't know. To me, if it's a ban of social media to 60-year-olds, I think, how to say, how do you say, like, I prefer it was just restricted in a way that they don't have access to everything. Not an outright ban. Like, not an outright ban, but there's restrictions to certain things. Something like that. Because, let's face it, social media is a way for people to get in contact with children, older people, like groomers. There we go, groomers. Yeah, parental controls. There we go. Yeah. Something like that. Like parental controls. I think they have that. They have that in the US. Like, you have parental controls for some things. Actually, not just in the US. You can do it on your mobile phones. So banned lang yung certain absence. Yeah, something like that. Although, like, it should be regulated. Not an outright ban, but more like, I don't know if it's possible to, like, regulate it. Because, teenagers will be teenagers. They're gonna like find ways. The thing is, they're gonna find ways. That's the problem. That's also the problem. They basically hingin daw ng digital ID para proof na hindi ka 16. Ibig sabihin, kung may nakaalita kang tao sa gobyerno, idodok ka, papakulong ka under cyber libel. Dami nang nakulong sa UK. I guess, but I don't know. It's like it's like weighing the pros and cons here, which is the better, like, is it better to keep the children safe compared to the chance of you getting doxxed? I think I don't know. I don't live in the UK, so I don't know how bad the thing with the teenagers and social media is there. Can I ban YouTube's parents for using it with babies? Mga bata siya yan, makakahanap din. Yeah, you know how teenagers are. They find ways. So you gotta, but you see, the thing is, if you're a smart parent who is active in social media as well, or active in the internet, you're also going to, find ways. If you're smart, you're also gonna find ways. All it takes is for the parent to be tech savvy and familiar with all these things, Sabi nga ng isang analogy dun sa alak at sigarilyo, diba? Paano nila malalaman kung yung kanilang produkto ay hindi bata? During our younger days, a scapegoat or venting place lang yun natin, yung noon yung social media. Parang ngayon, nag-evolve to something medyo out of control. Actually, yeah, when I was younger, I also had access to the internet. I used the internet a lot, even as a kid, but my mom actually would regulate it. Like, this is why the internet has always been in her room, so she regulates it. And even as a kid, when I'm using the internet, she really regulates. She tells me, okay, it's time to stop. And sometimes she would also look at what I am browsing or looking at. Nung time na yan, parang, ano ba yung hinahanap ko? Yung mga hinahanap ko nung bata ko, mga Pokemon pictures lang eh. So, so Pokemon stuff. But actually, when I was younger, I just remembered something. When I was younger, I remember... You're lucky that you have such a tech savvy. No, she's not really that tech savvy, to be honest. But she knew how to use at least at that point, she knew how to use the internet, and she knew about websites. And she's active in reading some stuff about So she sometimes reads articles on how some people use the internet to talk to children, and groom children. So she was aware of all of that. And she would tell me. She would always tell me, do not talk to strangers online. You never know how old they are. She would tell me that. Like, who are you talking to there? You don't even know that person. Like, she would get on. She would just be like that. Like, you're in a, there was this one time, I was in this Pokemon related website. I forgot what it's called. But it had like a chat room or something. And I was there, and there was another person there. I think I was 13 years old. I was 13 years old, I think. I think it was 13 or 12, I don't remember. And there was a person in that chat. A person in that chat room looking for someone. That person was like 18 years old or something. 18 years old. Looking for a girl. And I was 13, right? So I did talk to this person because I didn't know how old this person was or whatever, and then I asked that person, how old are you? And then he said he was 18 or something. He said I was 18. So I said, oh, you're 18, I'm just 13. So I said, oh, you're 18, I'm just 13 years old. I was like, I'm just a 13-year-old girl. And then, luckily though, that guy, that guy reacted funnily. He acted funny. He was just like, oh my god, I'm talking to a 13-year-old girl, go away. He said something like that. So I guess that's a good thing. At least he was looking for someone his age and not a 13-year-old girl. He was like, oh my god, go away, I don't want to talk to 13-year-old girl. And then when he reacted that way, I was laughing. I was like, lol. I was like, oh my god, 13-year-old, ew. Yeah, I guess that was a good thing. So I left. I actually left that. When he said go away, I just left. I'm like, okay. At least he was looking for someone older, you know. Not 13-year-old. Like, that was a funny react. I remember that clearly. That was so funny because I was like, how is this guy gonna react to Imagine if he reacted differently though, you know? Let's see, did I have any experience with any possible move? I don't think I did because, you know why? It was actually kind of hard for people older than me to actually, like, groom me or something because, my mom would always tell me, like, be careful, but she would be like, okay, you can use the internet. She would be like, you can use the internet, but be careful who you talk to. Don't talk to strangers. Don't give away never give away your information. Don't give away your private details, information. Don't give your phone number. You know, she would always tell that. Like, almost every day she would tell me that. So, like, I would go online and I would just, you know. And because she kept telling me that, syempre na-drill sa utak ko yun, di ba? So I would be very worried with people who talk to me. I would be very worried with people who talk to me. So, how to say? There were some people, so I don't know. I did make friends with people online that time, but you know, ano to? So they mostly acted my age. So I don't know if they were ever anyone older because nothing really happened. So I'm guessing they really were actually my age. I don't know, except for that one guy I talked to. But yeah, she would always tell me. Oh wait, I just remembered something. Okay, I just remembered something. I think I had one. Oh my god. Yeah, okay. I need to tell you. Okay, I have one experience. Okay. There was one time that we were able to ride ano yan? My parents during, I think I was, how old was I think I was 14 or 15 years old, around that age. Okay, around 14, 15 years old. My parents were able to get tickets for a cruise. Okay, a discount. They were able to get a cruise ticket, and since I was and kung may anak daw, libre. So I was free. so I got free. So I was free. And I don't remember, I forgot what cruise that was. Yeah, they got free they got, no, not really free. They got discounted tickets. Tapos libre lang ako. I forgot what kind of cruise it was. Kalimutan ko. Pero I think it was a I forgot what cruise it was. I don't remember which. But alam mo yung mga cruise, 'di ba? May mga yung mga chef doon, yung mga waiter at chef doon sa cruise, mga Pinoy, okay? They're Filipino. A lot of them were Filipino, okay? I was like 15 or 14 that time. A lot of them were Filipino. And in yung mga in those cruises, they have like activities for kids and teenagers, so I would attend those. I would go to those because you know, as a kid or as a teenager, it does get boring when you're in a cruise and you don't really have anybody to play with. So I joined that activity thing. So I get to talk to other people my age from different countries, and there's like different countries, different people from different countries. So I was like the only Filipino. I was the only Filipino, and I would be like talking to some person from somewhere in America, and then there's like an Australian, white people. I'm like the only Asian there. I'm the only Asian. The rest were like white people. And anyway, so and then when I'm hungry, so my parents would just let me roam around the boat on my own, right? So when I'm hungry, I dun ako sa buffet, diba? May buffet dun sa cruise. There's like a buffet, and since we knew that the Filipinos there, if they see another Filipino cruise customer or a cruise a Filipino customer or someone who rode the cruise was Filipino, natutuwa sila because syempre puro the ones they're serving are always foreigners, so they get really happy to have to see other Filipinos. So they found out, when we eat there, they found out we were Filipino, and they were so happy. And because we're Filipino, they give us like special treatment, man. They they don't like whatever's in the buffet. They would ask us, what do you want? Do you want anything? And we're like, what do you mean? And they were like, we can make pwedeng gusto niyo tosino, tapa, daing na bangus. I'm like, what the? I'm like, yo, you guys have tosino, you have bangus here? Sabi ko, may bangus pala. tapos the next day they would give us yung bangsilog, tosilog, bangsilog. And then the other people in the cruise, they would see our food and wonder where we got those because it wasn't in the buffet. We get special Filipino breakfast. May special Filipino breakfast. I ordered. I wanted bangus. So anyway, one of the waiters. So I would roam around the ship on my own, right? So I would get food, and then one of the waiters was being extra nice to me. One of the waiters is a dude, okay? He was being extra nice to me, and he would give me like special desserts or something, okay? And did they have tuyo on hand? I think they did, but I don't remember. No, I don't think they did because that smells. There's this one waiter who was being extra nice to me, okay? And then I think he offered he made something. He made like a dessert. I forgot what it was. What was that dessert? It was a Filipino. He made buko pandan. And he gave me buko pandan. Tama ba? Buko pandan. Yeah, buko pandan. I think it was buko pandan. It's like, oh, ito, mayroon kang special dessert. Oh. Like, okay. So I'm like, salamat po, thank you. So syempre kinain ko kasi libreng pagkain. Ano ba? Ano? Look, I'm like a 14 to 15-year-old getting free foods, free special food. Syempre, gusto ko yan. Uy, buko pandan. Yummy. And then yeah, and then I would notice sometimes. So when he's on break, I went to there's like a basketball court in the cruise ship, right? There's like this basketball court, and I would like shoot some shots, and then that waiter guy, I think he was on break or something. He would go up there and then start talking to me, and I'm like, I'm just being nice. And if I remember correctly, I think he asked where I was from in the Philippines. So I said, Metro Manila, blah blah blah. But I didn't really give him an exact, Syempre, at the back of my mind, I was being a little cautious. So I only said, Metro Manila, but I wasn't really, I didn't give an exact like location. And then I asked him, and I forgot where he was from. And he asked me how old I was. So I said, 14 or 15, I'm like 14 or 15 years old. And I said, sabi ko, ikaw, ilang taon ka na? Ikaw, ilang taon ka na? And he's like, he was like 20 something, 28 or something, 27, 28. So I'm like, okay. And then, basta, he was being extra nice to me that entire trip, okay? Until the end of the trip, okay? I don't think he really did any, I don't know, I don't remember if he tried to do anything. But, I think he asked for my email address. You look mature for your age. No, never. No one has ever told me that. You look mature. No one has ever told me that. Everybody who would look at me, they would say, and I tell them my age, they would be, you look younger. It's like, what? You're 15? Mukha kang 12. 15? Mukha kang 12. He asked for my email address. Yeah, he did. No. Because the first thing he asked for was my cell phone number, but I didn't have a cell phone. Bawal ako mag-cellphone. Bawal cellphone sa akin ng bata ko. But, bawal ako I did not have a cell phone at that time. Wala akong cellphone nun. Bawal ako magka-cellphone nun eh. As far as I know. Wala akong cellphone. I think I got a cell phone like after that. Sometime after that. After that, nagka-cellphone ako. Pero that time, wala akong cellphone. Bawal ako magka-cellphone. So he asked for my email address. So I gave my email address because I was thinking, email address lang naman. I was asking, email address lang naman yata yun. So, ayun. Tapos, the trip was over, right? The trip was over. And then I got an email from him, like, I don't know how long. I got an email from him a few days later saying, I gotta get this off my chest, ganon, blah, blah, blah. Tapos sabi niya, I love you. What? I was like, what the fuck? He literally said, wait, do I have a copy of that email? I never deleted. Do I have it? Do I still have it? Wait, let me see if I still. Maybe if I type in I love you, malalabas yan. Or wait, was it or no, I think it was a different email. Do I still have it? Wait, let me see. Baka Yahoo Messenger. Hindi. Well, no, it was not Yahoo Messenger. It was an email. Gago. Ay, wala na. No, I don't have it anymore. Because I think it was oh wait. Mahal na agad kita. Ganon nga eh. Search for yeah, I'm looking. I don't think, no, wala na yata. I think I deleted it. Yeah, I deleted it. It's gone. I don't have it anymore. I usually don't delete, but I think I deleted it because it weirded me out. I was like, what the fuck? I was like, what the hell is this guy? What? I'm like, doesn't this guy have a family? Why is he saying? You know, he did. I think he had a family, bro. He had a wife and child. He had a wife and kids. And then I received that. I'm like, what the hell? Typical seaman thing. He already knew I was freaking 15. Maybe he was bored. I have a feeling he probably tried to get me alone. Probably when we were in the cruise, but it's not easy to get me alone like that, you know? It's not easy to get me alone like that, you know, because I pretty much stick with my parents a lot that time, especially, you know, even in a cruise ship, right? It's a big place, so when I wander around, if my parents go out to, like, you know, ikot-ikot, I also roam around, but I stay nearby. I'm nearby, right? I'm nearby. And then I am usually on the go. I don't stay long in one area. I don't sit and stay in one area alone. I roam around. So I'm usually on the go. I'm usually moving. So it's really hard to get me alone. Because yeah. Nakita lang na maganda message agad. I was gone. What happened? Oh, we were just talking about my possible groomer experience. Some dude, when I was 15, an adult tried to hit on me. Yeah, I don't think when I think about it, when I was a kid, it was pretty hard for that to happen to me. Ganun pala ako dapat sa crush ko nung high school, diretso agad nagsabi. Yeah, he was like, I don't know, I don't remember the exact words, but it was something like, you know, I have to kailangan ko sabihin, gano'n, get this off my chest, I love you. When I saw that, I was like, what the hell? I was like, what the fuck is this message? Like, that is so weird. Wala kasi akong cellphone nun eh. Bawal ako mag-cellphone. You know, that's how my mom was. When it came to, like, you know, digital communication and you know, cellphone, bawal ako magka-cellphone dati. I only started having a cell phone when almost everybody had one. Like, almost yung mga classmates ko meron na. Ako wala. The only time I had a cell phone was when I actually started asking, like, give me a cell phone. Gusto ko rin ng cellphone. Gusto ko ng cellphone, mami, daddy, gusto ko ng cellphone. Yung mga classmate ko may cellphone, ako wala pa. Yung mga classmate ko may cellphone, ako wala pa. Ano yan? I would tell them that because it's like, bro, lahat sila may cellphone, ako wala pa. Ano ba yan? Ako naman. I have a question. Would it be weird if I say I wish to talk to a girl because majority of my friends are guys, and I can find talking to a girl to have a change of face? Like I feel more sunshine sometimes. What do you mean? Like you wish to talk to a girl? Because most of your friends are guys. I think I don't think it's weird. I don't think it's really that weird. It's probably weird if you say it out loud, but to wish it is not weird. Something like that. Yeah. Normal naman makipag-usap sa babae. Dapat sinabi mo, mapabigyan nyo ang pager. Oh my god, that's ancient, bro. A pager. Paka-ancient nun ah. I think... When was the last time when was the last time? The last time I saw a pager was like when I was what? I don't know. I don't remember. Nasa US pa ako nun. Speaking of first year college na ako nung nagkaroon ako cellphone. I got a cell phone sometime in high school. But yeah, it took a while. Like I only got one when I noticed all my classmates had one and I didn't have it. I didn't have one, so I started really nagging my parents. Like, give me a cell phone. Like, give me a cell phone. I need a cell phone. I want a cell phone. Dog, I just need to get this off my chest. Kailangan ko yata matulog. FOMO! Oo, na-FOMO ako! Na-FOMO ako! Lahat sila may cellphone, ako wala. Ano yun? Give me a cellphone! Ako rin! Gusto ko na cellphone. Lahat sila may cellphone, ako wala. Recently kasi nagkaroon ako ng ganyang mood. I was desperate to lift up my mood and pakiramdam ko hindi enough makipagkwentuhan or mag-vent out sa mga usual friends ko. I do have friends a girl, pero naroon yung feel na hindi sila yung right person to talk. I see. Wait lang guys. I need to... Okay. Maybe... No eh. You don't have... How to say? Maybe one day you'll find the right person for that. Maybe not now, but at least you can, I don't know. The fact that you're able to share share this kind of thing here on chat, I guess that's at least you're able to get it out in a way. I tried talking to somebody else, the girl, but the next day I realized na ang weird yata ang ginawa ko. I shouldn't have done that. It depends on how you approached it. How approached her. Oh wait, what's this? Doc, is it like that you have to know what love and relationship to watch rom-com? As my friend said that I can't watch rom-com anime as I don't understand love as my last female interaction is to be what? No. No. Rom-com it's rom-com watching that's entertainment, man. It's you're watching something. You don't need to know what it is to enjoy watching that. You know? Yeah. But yeah, Nue, it depends on who you're talking to and how you brought it up. Like, if the person is okay with it, then it's fine. You know? Yeah, they're what Fab Master said. As long as they're fine with it, it shouldn't be a problem. Rom-com is scripted friend. We need to touch grass more. Ironic how so much. Yes, yes. Ouch. Oh god. Okay. Oh my god, it is 11. Oh my god, I've been yapping for almost 3 hours. Yo, I have the energy to yap for almost 3 hours. It's 11:50. Nice. I have energy. I vented out about my circumstances these past weeks in Discord. Paano kasi I was hoping for a single day na makakadaldal ako personally sa mga in-invite kong friends na taga dito and I ended up alone. Oh, I see. Well, I don't know, in Discord, I don't know. If you need to vent, you can vent on the Discord server venting channel. I think some people in the community are willing to listen to you, I believe. You know? But sometimes some people are also busy with some people are also busy with whatever they have in their lives, so sometimes they won't really be able to answer right away. Like, look at me. I had so much stuff going on the past few days that I really did not tweet much and I didn't really talk much on my own Discord and on my own server. Like, I would just like drop by, say something, and then and then I disappear. You know, not everybody is available. We all have our own lives. You know, we all have our thing too. So it's not like people don't care. It's just that we also have some people have stuff in their lives as well that they gotta deal with. We all have our own challenges to face. We all have our own things to do. It's not fine that she's 15-year-old and you sent mahal kita sa email. Shiori, bago ni last name. Oh my god. Sleep deprived Chatina. Holy lack of context. I just re-entered. Hello. Yeah, we talked about a lot of things, I think, and we're on a different topic now. Oras na para umpisa ng ShioriPon Evil SG. I don't know if although, to be honest, it is kind of tempting that Evil is in Singapore, and Singapore is just like a few hours away from Philippines, and considering it's only a few hours away from Philippines, and I don't think it's that expensive to go there either compared to like Japan or other, When is it? January? I don't know though. It depends. It depends on some things. Because relatively cheap, but yeah, compared to like Japan and Korea or wherever, it's cheaper in Singapore. It's just I don't know. I will think about it. I don't want to make a dono goal for that when I'm not sure, okay? Baka kasi gawa na akong dono goal, mag-donate yung mga tao, for a trip that's, and it's something that's not even for charity. It's a personal gain in a way, personal thing. So I don't know if I should even and I'm not even sure if I will, or more like I don't know if I should go or not, because I'm thinking of, it's still in January, so I don't need to think about it too much now. It's not a charity thing. It's gonna be a personal thing, so I don't know if I should even do something. It's just, I anticipated the worst might happen na bigla lang talaga akong walang natira kahit isa. Kaya nauwi sa stress eating that day. Pag uwi ko, bumalik yung toxic feel na hindi na-hit. Nag-manifest pa sa akin ng ilang araw after nakaranas ulit ako ng chest discover para nakita ko. Like, pag nagagalit na iinis ako, like, what the heck? So talagang nagsistruggle na maging okay. Okay, Nue. You can try talking to someone, anybody, okay? It's okay to just, you can just chat with someone. If they don't reply right away, it might be because they're busy, okay? It might be because they're busy, but if they care, they will get back to you. Okay? Because, like me, for example, some people have, I tend to kind of not reply right away, especially when, people say stuff to me, but because I'm so busy, I read through it, but then I forget to reply or forget to say something because, my busy life. But it doesn't mean I don't care. It doesn't mean that I'm ignoring. It's just that some stuff get in the way. I recently found out why my friend hate anime because someone recommended him Redo of Heal. Oh my god. Redo of Healer? I saw clips of that and I was like, what the hell? I have nothing to say about that anime, girl. Madaldal yan si Doc. Last time nagulat na lang ako, nag-chat sa akin tapos napadiretso. Depends though. Ngayon kasi this weekend, I don't know, even I think the days to come, I still have a lot on my plate. I have a lot on my mind, especially work related. My patients who are still admitted, one in the ICU and the one I just operated on, emergency surgery. So I do have a lot to think about. That's why I'm not so active in my Discord. I probably just say 1 to 2 things and then I just disappear. Sensya na napakwento na nag-bottleneck kasi ako na nakapag-flash kahit sa mga ritual ko. Nag-check ako ng booking. 1 patient round trip, January 9 and at least... Oh wait! Si Mana-chan, pinaplano na yung trip! Pinaplano na yung Singapore trip! Hindi gigil sa teka mo. Diyos ko. I don't know. I don't know. It is tempting though. I mean, I am interested though in the Evo of Singapore, but I don't know if I will go. So it depends. It really depends. So I can't say right now. I can't say for now. Okay. So maybe I'll decide sometime later in the year. I don't know. Right now, I can't decide because it's like 6 months away. Hindi pa ako makadecide. So, biglang may emergency surgery. No, if I'm gonna go there, I'm gonna file for a leave. Magli-leave ako. Bahala kayo. Bahala yung emergency na yan. May funds pa bang tonight? And yeah, there's that. I don't know if I have funds, travel funds. That's the thing. So, it really, I don't know. Depende talaga. Depende talaga. Anyway. It's 12! It's 12, guys! I've been yapping for like 3 hours. Ubusin mo merch stocks ni Doc para may travel. Wala nga maipon. Nako, Pokari! And considering that I have a Dakimakura arc already, considering that I am planning to release a Dakimakura, I'm just thinking when. Teka, saan na ba yun? Do I have it here? I am looking at my Dakimakura. The possible Dakimakura. Automatically allocated budget for your merch though, yeah. That reminds me, I should actually look for a printer for this. I mean, like, where I can have this printed. Separated savings account. Like Gcash my savings account and it says ShioriPons. What's up na ako, Doc? Mga par, we'll try to hit 7 hours. Okay, have a good night, Noe. Have a good night. Speaking of, Doc, di ba yung convention this coming August, yung venue doon sa may Pioneer, doon sa may Robinson's Pioneer? What convention? I'm not even thinking of any. Oh wait, the ano? You mean on live? You mean on live? Is that what you're talking about? Oh yeah, you just reminded me. Yeah, on live. I totally forgot about on live. So sobrang busy I forgot that. Yeah, I am part of on live, by the way. I am. Yes. Kakanta ka ba dun, Doc? Secret! It's a secret! Tutuliin ko kayong lahat doon. It's gonna be a, live circumcision for everyone that's there. So, pag nanood kayo, if you guys are there, wala na. Tutuliin ko kayo live. But actually, wait, where's the, on live. On live. Actually, in-announce naman yung online, or is it? Online. Where's the announcement with me in it? Oh yeah, okay, here we go. Yes, actually. So, ito ano pala eh. Here we go. Let me show you guys. Ito. There we go. See? On live. So yes, actually, yes, kakanta ako. It's I'm part of the VTuber medley. So yeah, a medley VTuber concert party. Yeah. So yes, I will be on online. Magdadala na ako light stick. There's a lot of people here. There's actually even Maddie's here. See, Maddie, Dasu. Marami din pupunta. There's a lot of VTubers that will be present. Like Chio, Nemu, Sagi, Nemu is gonna be here. Hiro. Ano ba? Lunali. Si Lunali. Marika. Senstellano. Marami. We're a lot. Alena May. Marami kami. Jumbo hotdog pa yan. Pag jumbo hotdog yan, pupunta ako. Ba, kung hindi jumbo hotdog, di ka pupunta? Ganun ba yun? Pag hindi jumbo hotdog, di ka pupunta. Yun lang yan. There is still summer in Philippines, right? Because where I live, for the next 4 months, there will be raining all the time. Yes, in the Philippines, it's just summer and rain season. Wet and dry season. It's just either hot, hotter, or hottest. And dry or wet. Punta ka para malaman. Oo nga, punta ka na lang, Pop Master, para malaman mo kung may jumbo hotdog o hindi. Kahit di yung jabolso. Gagi. Tama nga ba, Oshikon? No, online. I'm not in Oshikon. I'm in online. Nga no, that parang they're happening at the same time, no? On live and Oshikon. I am in on live. I think, wait. Naman, ilang days yung Oshikon? Oshikon is 15, 16. I think on live is just, 1 day lang naman yung on live. It's just 15, so. You can actually go to both if you think about it. Like, on live sa 15, Oshikon sa 16. Kasi Oshikon's like 2 days. On live is 1. Anyway, it is 12:08, guys. I gotta go to bed. What does your daily routine look like? I wake up, eat breakfast, go to work, go back home, rest, stream. And sometimes it changes. Like go to work, do a surgery, go home, sleep. Supporter ko. Wait, punta rin ba kayo ng Oshikon? No, I'm not gonna be in Oshikon. Going physically to Oshikon though, I am not sure. Kailan ba? I'm not sure. Oh wait, actually no, I don't think I can. I just realized. No, I can't. So the only event, it will be online because I have to study for exams, guys. I have my oral exam in August. Walang lad sa daily routine. There's a new... Wait, I am going to be streaming Love in Deep Space soon because there's a new love interest, the werewolf guy. Werewolf guy. Anyway, guys, I think I have to go. It is 12:10. I have been yapping for 3 hours already. I think we are good for today. May nagsi-stream ba? Can we... Oh wait, I forgot. I'm not on Twitch. I'm on YouTube. Nasa YouTube pala ako. Let's see. Who can we raid though? Let's see. Who can we redirect to? Yeah, I think we are good for tonight, guys. I also have to go to bed because I got work tomorrow. Yeah, 3 hours of me yapping. I have energy. I thought I wouldn't be able to yap for 3 hours, but apparently I was able to, so... Which is a good thing. It means I have my energy back. And I am ready to play. So, tomorrow, my next stream will be tomorrow. We're going back to Twitch, guys. Tomorrow, and the rest of the week will be on Twitch. Tomorrow, I will be playing Idol Showdown. I've been wanting to play this game. So, I'm gonna try it out tomorrow. And then, after tomorrow, next stream will be Thursday. It's gonna be Tekken stream, and then Saturday, Tekken stream. Yeah, we gotta get back. We gotta get the GOD back. I gotta get my God of Destruction back. I gotta, you know, remove the rustiness. Nakti tayo tigil sa pagdadasal para sa exam. Oh, thank you, Mana-chan. Thank you. Salamat sa stream, Doc. Natutunan ako tungkol sa pulupot isaw. I'm glad you guys learned something. Yeah, of course. It's always like that. I rank up and then I demote. And yeah, I think I'm gonna try uploading the other VODs that I haven't uploaded yet. I was able to salvage the Claire Obscure, so at least that one is complete. Kinda, yeah. Kinda complete, yes. It is complete. Seika? No, I can't. I don't know. Wala. I cannot raid. Teka. Hindi ko ma-raid. No. Yeah, say YouTube. No, I can't. Seika. Nope, hindi ko ma-raid. Nope, hindi ko ma-raid. Alright, so yeah, thanks guys for coming to my stream. I'll see you guys on Twitch tomorrow. Bye-bye, and Otsupon, good night. Bye-bye. you